Hi everyone, thank you all so much for coming today. We're so excited that you're here. I just wanted to do a couple housekeeping items. One, if everyone could just maybe turn off their cell phones, please. And two, if you are looking for the washroom, it's just through the doors to your right. We're very excited today to have Jack Veitch and Ryan Luscombe from the Canadian Mental Health Association, Haliburton, Kawartha, and Pine Ridge. Welcome, Jack.
Amazing. All right. Well, thank you everybody for coming out here this afternoon. When I see a beautiful sunny June day and you decide to come in here in your lunch hours and listen to us talk, that's exciting to me. So thank you guys very much for coming here and welcome to Mental Health Works. So what we're going to give you in our next 45 minutes to an hour or so is sort of a truncated version of this course. You're going to get a sneak peek, and I'll tell you, this course is actually offered at cost. So this is typically something that we will charge for, but we love the Chamber and its members. You guys are getting a sneak peek for free. So you're going to get to see this fantastic course and what it can offer you and your organizations. So like we were so kindly introduced, my name is Jack Veitch. I am the health promoter and educator with the Canadian Mental Health Association, Haliburton, Kawartha, Pine Ridge branch. So that means it's my job to go out and I talk to businesses, I talk to schools, companies, and I teach about mental health, mental illness. More or less, I teach people how to stay well. So in this role, I teach courses in things like Mental Health Works, Assist, Mental Health First Aid, Safe Talk, Living Life to the Full. And actually, through the Talk Today program, I get to work as a mental health coach for our local OHL team here in town, the Peterborough Petes. I can tell you guys that prior to doing all of that, I used to work for the organization as what they call a forensic case manager. So people in here may not be familiar, but back in Lindsay, we have a maximum security provincial detention center. It used to be my job to go into the institution, and I'd meet with inmates, either diagnosed with a mental illness or had a suspected mental illness, and I would assist them when they were released from jail. So it was my job to help them find a place to live, or a family doctor, a job, psychiatrist, whatever they identified sort of as their needs or their goals. So I did that for 4 or 5 years, then decided I need a desk job. I need something a little bit lighter, so here I am. And today I'm very fortunate to be joined by my good friend Ryan Luscombe. Ryan is our Kids on the Block coordinator and also fellow mental health educator, health promoter. Ryan is a master assist trainer, that's a real credential. He is a Safe Talk trainer. He is actually our only trainer, maybe the area's only trainer, in Assessing for Suicide in Kids, a brand new course which we'll talk more about later this afternoon. Ryan and I are going to walk you through this first little sneak peek version of Mental Health Works. We're going to start off by talking about the challenge. And I'll tell you, when we think about workplaces, there's this key idea. Is this a performance issue or is this a mental health issue? And, you know, I can ask a lot of employers. And if I ask them, can you manage a performance issue? 99.9% to 100 will say, you know what, I can manage a performance issue. But when we throw in that little caveat, is this a mental health concern? A lot of times we see that sort of trepidation, a little bit of nervousness or fear. What do I have to do? How do I approach this differently? How does this impact what I'm going to do moving forward? What we found is that only 36% of employees would discuss their own mental health concerns with a supervisor. That tells us that 2 out of 3 are not seeking help. There's a 60% drop in family income when the primary income earner is diagnosed. So you could think about that. We talk a lot, and I mean, Ron and I do all kinds of talks about stigma and mental illness and how it impacts in the workplace and health in general. You look at that statistic and you see there could be a very real fear of why an employee could be nervous coming forward and talking to their employer, their supervisor, their HR rep. When we're talking about income and wellness, what we're trying to do, and I think Ryan's going to explain this, we're not just looking at specific instance. So I'm going to ask you guys, but what are your challenges? And I'm sure you could think of what some of the challenges are at your own unique organizations. And what we want to highlight isn't just dealing with specific instance, but rather implementing an overarching method, an approach to how to make my entire workplace a mentally healthy workplace. One of the terms we'll talk about is positive psychology and positive mental health. It'll come along as we go through. So again, why is this so darn hard? We have 3 kind of main reasons. 1, a lack of high quality awareness. What are mental health problems? What is positive mental health? Again, that key idea. Maybe I can help somebody who's struggling. What about people who are my employees are already doing well? Am I aware that I can help them do even better? That core concept, positive psychology. A lack of training of how to respond effectively for both leaders and coworkers. This isn't just a course for leadership, for management, for senior representatives. This is for everybody in your workplace. We need everybody on board. if we're going to make this a mentally healthy workplace. And I'll tell you, that's why I was so encouraged. I got the email actually from Carrie yesterday showing me the numbers that were coming out to this afternoon's talk. And it really encourages me, and I always say that Peterborough is absolutely, and I'm not just pandering, I mean this truthfully, Peterborough is a leader when we talk about mental health and wellness. And when I see all these workplaces come out, it really assures me of that and helps me feel good about what I do. And lastly, that lack of collaboration on psychological safety. How do I make my employer or my place of work mentally healthy? We can think of all these different barriers. Can we imagine some of those impact our own workplace? I think absolutely. I'm going to show you a little diagram. A little bit trippy, I think. So again, hopefully you've had your morning coffee before we throw you into this exercise.
Not too much.
But not too much. That's a good point. Mentally healthy workplace. Some people look at this and they think, oh, is this like a GIF or something? Is this a little... This is actually a still photo. But I want to ask you, when you look at this still photo, someone put their hand up, tell me, what do they see? Movement. Spinning wheels. Someone tell me in here, if you fixate your eyes on one specific spot, what happens? It stops moving, but what about everything else around it? It keeps moving, doesn't it? Kind of a neat little metaphor or analogy for our workplace. We can absolutely focus on one thing at a time. And I mean, some people say they see little snakes, little snake tongues. Maybe I focus on one thing in here. Maybe I focus on one thing in this chart, and you know what, for a minute it stops moving, and I can think about it, I can move forward, I can fix it in my workplace. But is everything else slowing down or stopping? No, everything else keeps on moving. This was meant to give you that idea. This is all about perspective. Again, focusing on one thing at a time. Sure, we're going to be able to find a solution to that, but we need an overarching approach. We need a bigger plan. If I try to deal with this picture to make it stop moving one circle at a time, we're going to be here past 1 o'clock. We need to take an overarching approach. So what's that reality? We know 1 in 5 people in Canada will experience a mental health problem each year. 1 in 3 in a lifetime. I'll tell you, when we talk about stigma and how it impacts health and wellness, we can probably assume that these numbers are underreported. You can safely assume that might even be 1 in 4 or even 1 in 2 in a lifetime. This is something, frankly, that will impact your place of work. We know 500,000 people miss work every week. 30% of all disability claims, and I'll tell you that's up 7 to 8% in the last 10 years. 30% of all disability claims are a result of mental health concern, 70% of costs. Mental illness in the workplace costs Canada $51 billion annually, every single year. Again, we're not coming in to teach just necessarily specific, how to rectify specific instance. We want to take a whole big overarching approach. So what do? We want to engage people in solutions. We want to allow people to feel heard and respected. And you know, one of the things, the psychological standard for their health and safety in the workplace, people have heard of that standard, 2012 came out. I'll tell you, one of the big pieces of it is understanding how to help employees feel heard, feel expected. You know, you ask employees what they want, sure, maybe they'll say a pay raise, maybe they'll say more money would be great. But I'll tell you, ask a lot of employees what they want, and it's right here. To feel like my opinion is valued, to feel like I have a choice, that I'm invested, to feel heard, to feel respected, that I'm a part of this team. That's a big part of what we talk about through this course. Increasing feelings of trust, security, and value. We want to reduce or eliminate barriers and risk of harm. We want to support health and safety overall. And that's what Mental Health Works does. So this course, this isn't just a course that runs here locally. This is a national course. This is a Canadian course. Actually, it's been running for the last 15 years, running all across Canada. It's actually governed and run by CMHA National, and only CMHA employees get to deliver you this course. Isn't that funny? You got to deal with my face for the rest of the little while. You know how to sit in the front, I'll tell you that. This, again, is a national course that has a lot of evidence-based research behind it. What do we need when we start a course like this? We need a strong foundation, a strong base. When we talk about health, we're not just looking at one piece. We're looking at our physical health, our social health, and our mental health. Isn't that neat? It makes our CMHA logo. Health is so much more than just one aspect. You need to look at that whole person. There's going to be a, hopefully... Someone in the back was impressed. That was neat. I can't stand that. But again, our logo to show about health. So what is mental health? Mental health is a state of well-being in which an individual can realize their own abilities, cope with the stressors of everyday life, work, study, play effectively. I mentioned earlier I teach a course called Mental Health First Aid. And in this course, if people here have ever taken it with me before, one of the first exercises that we do, so I'll put a big piece of chart paper up on the board, and I'll just write out what is mental health. And I can't tell you how many different groups, 99% of them will say mental health is not having a mental illness. Mental health is so much more than just the absence of illness. Again, it's how we're productive, it's how we contribute, it's how we're involved in our workplace. The key idea being everybody has mental health. Everyone has mental health, just like we all have physical health. I can be mentally healthy, just like I can be physically healthy. I can be mentally ill, just the same as I can become physically ill. We all in this room have our own sort of mental health spectrum or continuum, and we're going to show you what that is as we go along to our next slides here. So here we have the mental health works sort of interpretation. If you've taken other courses with me before, I've shown you different spectrums too. This is our mental health works spectrum of what mental health is. So we can see right in our green is our balance, and that's sort of where we all want to be. We want to be in that green, that balance. We want all of our employees in our workplace to be in that 5. Now it's important to know that balance, I can guarantee, is going to be different, a little bit different for every single person in this room. Not everybody in here will have the exact same 5, that exact same green zone. We're all unique individual based on our life experiences, on our genetic makeup, on things we've done, what our workplace is. All of it indicates or dictates what my spectrum sort of starts at, where my baseline is, so to speak. The other thing I always try to teach is that we can move on our continuum, and moving on that continuum isn't necessarily a bad thing. If we move towards activation, excited, pumped up, energized, even nervous, that's not a bad thing. We move back to our deactivation feeling sad or angry, frustrated, upset. All natural human emotions. What we don't want to do is keep people from moving outside of that green zone. Feeling sad, feeling angry, feeling excited, feeling hopeful, energetic. Those are natural, good human emotions. Where we get concerned is when someone has trouble finding balance. When we think of a concern in our workplace, what I'm worried about is when someone has difficulty coming back into that green zone, coming back to that 5. This is our animation showing how you can move in that spectrum or continuum, just like I explained. Very artistic, I know. So again, when we look specifically at problems or illness, we're talking about changes in thinking, mood, or behavior. It can be triggered or aggravated by something. It could be an unhelpful coping pattern. It could be associated with different things like significant stress or impaired functioning, any other kind of physical health problems, and it's sustained over a period of time. When I teach any courses about mental illness, there's 2 things that we need to remember. That difference between that natural, normal human emotion and perhaps something more. Prolongment and impairment. Mood is lasting too long, and it's keeping that person from being able to do the things they need to do on a day-to-day basis. In our scenarios here, quite possibly, workplace, day-to-day life. Being able to do my work the same way. Being able to contribute with my family and my community. When I see prolongment and impairment. So I teach about things like depression, which I'll show shortly. And every time I teach, I'll get a variation of the same sort of question or response. Jack, everybody gets sad. It doesn't mean everybody lives with depression. I'll say, you're absolutely right. Everybody does get sad. That doesn't mean everybody experiences depression. That key difference again, prolongment and impairment. That sadness lasts too long. And it starts to keep that person able to do the things they need to do in their day-to-day life. So let's take a look here. So you imagine now a person sort of moving towards that deactivation stage. Again, people feel sad or upset, frustrated. That's not necessarily a bad thing. Where I'm concerned is when sort of this invisible barrier can come in, and it can kind of pin that person in that one area. So now as a result of that barrier, I'm not getting back into that balance. So now that low, that sad, that upset or frustration, that feeling stays. It persists. It continues. When it continues for at least 2 weeks, this is what we'd call clinical depression. And you can start to imagine now how this would impact all the things that I need to do in my day-to-day life. Imagine me even here today, coming in to do my job this morning. And I'm here to speak. And imagine if my barrier got put up and I got stuck in that deactivation stage. We could all imagine ourselves how it's going to impact something as simple as public speaking, coming up here and talking with a smile with my friend Ryan. Imagine all their own different workplaces, the tasks, and the things that need to be done on a day-to-day basis. If that person is stuck on that continuum, that spectrum, in that deactivation stage, how that's going to impact their day-to-day work. Any questions about any of that so far? Just so darn clear you'll never forget it for the rest of your life, right? I'm going to pass it off to my friend Ryan to carry on with it.
See if I can do this. All right, you had the funny guy, now it's the straight man's turn. Sorry, folks. Never been called that, Jack. Thank you, though. Thanks very much. Okay, so if we're imagining this is happening in a workplace where we've got employees that might be being stuck in that deactivation phase, then what are we looking at in terms of how we deal with this in a comprehensive way? So we want to look at things that might protect that individual from getting there, or at least getting there based on what's happening in the places that we work. So we're going to look at things like, protective factors. So things that might protect that individual from depression. So an awareness of mental health is something that can protect us from depression. Is that something we can provide in our workplace? Absolutely, absolutely. We can provide in-service, we can provide programs like Mental Health Works. There's a lot of different things we can do to show that we're being a mentally healthy workplace and showing that awareness. Adequate formal and informal supports, is that something we can do in our workplaces? We hope so. We don't know what adequate is, but it's something we can look at more in depth. However, you probably have some things in place so that people feel like they can be supported. Connectedness to others. How are those employees at your workplace relating to one another? What is the relationship like between management and employees? What about in and amongst each other? What about in and amongst departments, for example? How's that working? And is it something we can work on? And then high-end reinforced self-worth. And that's a difficult one to do in the workplace, although taking something as simple as our performance reviews, taking a look at them instead of being based on deficiencies, looking at them as though they're strength-based, right? What are the strengths this person has given? What kind of contributions have really worked for your workplaces? So that's one sort of way. You're getting the feeling I'm the HR guy here? Yeah, that's why Jack passed me these slides and that's why he did all the mental health stuff. So we can do things in our workplaces to help reinforce that self-worth, but the individual also has to be aware of it and be able to do that for themselves to some degree as well. So those are some protective factors, and that's depression. It's one of the biggies, right? It's very commonly diagnosed. Another common diagnosis you're going to find is anxiety. So what does that look like on the spectrum? There it is. There it is. So anxiety, when someone gets overly activated, right? Some nervousness, some fear, but then being stuck in that fear. Can anybody here describe for me a time that they were particularly anxious? Something that made that, like there was a situation, let's call it work-related to keep it nice and safe, but when they were feeling anxious, can anybody offer me anything? What was happening? No names, please. Yeah, please.
I was coming to do my introduction today, and my heart was pounding.
Oh, okay. And then we basically told you not to worry about it.
Because we're mental professionals.
Okay. Now, your heart was pounding. What else? Describe some more of the physical sensations, even mental sensations.
I could feel nervous, like I didn't want to mess it up, and I was practicing so I wouldn't mess it up.
Right.
Then I practiced in my car. When I got here and met you, I felt better, so.
Okay. But for a few moments there, you were elevated, right? Your heart was pounding, you could feel the blood coursing through your body, your mind just wouldn't stop thinking about the same thing over and over again. Oh, I'll feel better if I practice. Yeah, there you go, you're getting a little bit anxious, right? But now imagine being stuck there. Right? Being stuck in that place. Fear, concerns, worries, these happen to all of us. Again, Jack described it, right? There's a range of natural human emotions, but what happens when we get stuck there? What happens if it's prolonged? What happens if it's interfering with our activities of daily living? And that's what's happening with the anxious person. So imagine living with, you could have got a queasy stomach. You could have had excessive fears. If you were worrying about it for days, kind of thinking about it starting last week, maybe you started having bad dreams, not sleeping, not eating. There's a lot of things that could be associated with being overly activated. Sometimes being a little bit activated is good, right? I had a lot of work to do when I got home last night from Toronto. And I was a little bit excited, a little bit nervous, a little bit of energy, drank a little extra coffee yesterday. It worked out for me. It all worked out fine. So I was that way for a little bit. But what we want is that person to come back into balance. And I'm feeling balanced today, but imagine that employee that's stuck there. So what can we do for them? What kind of protective factors do we have for them? Sorry, and just really quickly, this is, stuck in a high level of activation, someone who's anxious, but then when we get into crisis, and this was true too of the overly depressed individual stuck in this crisis mode, mania, where that person has all the energy, has huge expressions, right? So there are consequences that if we get too far into that activation and stay there for too long, that things such as psychosis, suicidal thoughts, panic attacks, right? So we have consequences, not just the sort of physical symptoms I feel when I'm anxious and I'm anxious for a long time, but there's other further consequences if it gets too bad and if we don't take care of it. One of the things we learn about mental health, learning disabilities, developmental disabilities, the sooner you attend to the problem, physical health, the sooner you attend to the problem, the more likely you are to have better results faster and for longer. So the benefits are overwhelming to attending to this situation. So recognizing it as an employer is very important. All right, so those protective factors. So again, awareness of environmental stress. That's good for any employee to know, but thinking about it as a manager, if we're leading people, are we fully aware of what kind of stress certain tasks put our employees? Are we aware of their strengths and weaknesses? Are we giving them tasks that feed into their strengths? Are we challenging those weaknesses too much? Do we need to do some professional development to support that? Learned coping and grounding skills. Again, some people come with those, but can a workplace provide those? Can we provide effective stress reduction skills? Can we give that person an opportunity to de-stress? Can we offer one extra break from time to time? Can we bring in somebody to do yoga for half an hour over lunch hour? What are the kinds of things we can do to help provide some of those stress relievers? And then predictability and stability. Right? If we can provide a workplace where a person knows what's expected, knows the way people are going to treat them, knows how a manager or coworker is going to respond in tense situations, because they're still going to happen, is there some way we can regulate or normalize that? All right. So, the overall mental health works approach we do in 3 gears. The description we gave of the course had the arc: awareness, response, awareness, response, and then collaboration. So awareness would be something you've noticed, something you're aware of. Again, as employers, we're not allowed to ask about mental illnesses. It is illegal, but we can tell people that we're aware of behaviors that we've noticed, things that we've recognized about their performance. So I've noticed, I'm concerned about. And then next stage would be, tell me more. I want to hear more about it. This is my response. I want to know more about what I can do for you. Can we do it together? How can I work to make work work for you? And then if we need to, park, right? Stop everything. It sounds to me like you need help now. Here's what we can offer. We have this EFAP program. We have someone in HR you can talk to right now. We've got, who knows who's on staff that might be available to them, or what other services that you know you might be able to provide. And those might be formal, again, or informal. All right. So, what does psychological health and safety look like overall? The standards Jack mentioned earlier came out a few years back. The official publication came out right brand spank in the new year of 2013. They had been developed and sort of announced in 2012. And it was put together by the CSA group, the group that basically develops standards for Canadian workplaces. And what they determined was that, with the help of the Mental Health Commission of Canada, that we need to start looking at standards for the mental health of our employees, of all workplaces. So what they did was they enacted this set of standards, and in that set of standards there are 13 factors, 13 aspects that they want you to look at and think about as employers. And so we're going to just take a really brief look at one of them. So, psychological health and safety. This is the sort of descriptor of what we mean by it. Hazards, risks, addressing unknown factors. And organizational culture is one of those factors. What would you say organizational culture is? What does it say to you? Ignoring what's here. If you could give me a sentence. Yes.
If you feel safe in an organization to be able to go and talk to your supervisor about something that's troubling you.
Okay, so safety could be a positive piece of an organization that had positive organizational culture. So safety would be a part of it, sure. Yeah.
Possibly like a set of like standards and the way that things are done, so that everyone knows exactly how they proceed as a group.
Okay, so as a group, we have a certain expectation and possibly policies and procedures about how we proceed as an organization. I'm seeing a lot of fear in a lot of faces. I know, it's the HR guy in me, it's coming out. And it's a lot to think about, I recognize. And we're looking at a very broad picture. And I know Jack showed you that, the mesmerizing snake photo, as I like to call it. You know, the mesmerizing snake photo showed us, yeah, we can focus on one thing, but everything else is still moving. But at some point, we do need to dedicate one time to one thing, right? We can't multitask all the time. But if we do get a broader picture in place, then sometimes those moving bits can fall into place. So if we can look at our workplaces from a mentally, just what can we do, standing item, what can we do to be mentally healthier, then that's a really good start to being a mentally healthy workplace. But if we look at culture, I really like that idea. It's how things are expected to proceed in our workplace. It's the way we come to expect people to respond. It's the way in which our organization says, this is the way we do things. And for some workplaces, that's not always positive. It's just, you'll hear people say, well, that's just the way it's done around here. When you get that challenging behavior, yeah.
I was going to say, there's almost an unsaid way that things are dealt with, as well as we have the open way that things are supposed to be dealt with.
Right.
And then there's the culture of the way things are really dealt with.
Right. And we find that, it does really help when we have leadership that demonstrates the way things are supposed to be done, but then you'll get little nuances inside different departments, for example, or different little mini teams inside of a department and things like that. Well, this is just the way that things are done, and this is the way this person just always responds. So yeah, there's some unsaid stuff there, but can we say things? And can we change those things that we don't find positive about that organizational culture? And the answer is yes. If we set up a series of guidelines, you sort of hinted at that, right? A set of guidelines, and we say this is how we proceed. These are the things we believe in, right? Our mission, our vision, our values can help dictate what that organizational culture looks like. So when something challenges that, so when something seems to be at odds, we can say, you know what, that's not fitting with what we believe. We need to change this. Why is this happening? Oh, it's the way it's always been done. Can that be changed? Absolutely. Absolutely. All right, what are the benefits of doing all of this stuff, right? Why would we do this? First of all, the legal case would say there's a good chance the standards, the psychological health and safety standards, they're not mandatory right now. But, legally, there's a strong belief that the standards will be enacted and required sometime in the next, say, 5 to 10 years. There's a real strong case that some of the business law that's coming out is saying, yeah, you know what, there is a form of responsibility here. Maybe we need to look at workplaces being mentally healthy. Yeah.
So I know it's not, like you said, it's not actually made to be put in place by the employer, but what if in a situation that an incident does happen and it goes to the labor board or your union, like where's our obligation then from a mental health perspective if there was an issue and they didn't address it properly? So yes, it's an obligation to educate your staff on what they need to know and where to go and blah, 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 but on a personal level or human being level, and it's gotten out of control, where's liability? Like who gets not the blame, I don't want to do blame, but who is responsible for letting that person
Right.
lead?
What were you going to say, Carrie? Sorry.
What I was thinking, one of the responsibilities, whether it's a mental illness or a physical illness, an employer has a responsibility to make accommodations in the workplace. So there is a
If they're not seeing it happen until it's too late, is what I'm saying. So if they're not asking questions, if they're not, acknowledging that it's even happening, but other employees are. So technically it's not being for employees to share this information. And if that person's not willing to help, and it gets to that third step or legal perspective,
There is actually an obligation for the worker to ask for an accommodation if they don't disclose. If they disclose that there is a mental health concern, then you are obligated to offer an accommodation.
what if they don't? Is it just, they don't?
If you offer it or you don't offer it at all, or I guess that's
the person doesn't feel comfortable coming to that manager and letting them know about needing accommodation, when they just struggle, like they're in that activation stage or the whatever deactivation stage, and they just stuck.
And you know what?
So everybody else is moving around and they stop. Nothing else is affected in the workplace. So how do we know?
Yeah, and it speaks to like where we're at in the workplaces is a lot of us don't. That question Jack asked from the very beginning, is it a performance issue or is it a mental health issue? If it's impacting work, it's still a performance issue. In that case, it's knowing when to have that conversation, that supportive conversation, and starting it. I'll go back if I can. It's going back to our gears, right? I've noticed. We've got to start having these conversations with people. And, that's a big part of the full day. It's a 6-hour session that we run. That's a big part of it, is how to start having these conversations, how to make these accommodations, what kind of things we can put in place to make work for this individual. Now, accommodations, they're a slippery slope in themselves, because once you start accommodating an individual, other people might look around at that and say, oh, flex time, we've never been offered flex time before, maybe I need to request an accommodation. So it can be quite slippery, but the goal is always getting that person back to their regular working duties, fully functioning and feeling balanced. We want them in the middle of that scale. So, I can't answer that. You know, if there was really good reason for the manager to possibly ask if they could support that individual, that's sort of neglectful. I don't know how a court would look. I don't know if there's a precedent for that legally. But if they do make you aware that there is a mental health issue, then you do need to offer an accommodation. Yeah, please.
If again, as an employer, you are doing all these things already, because you know what, maybe that is the way I have all these close to me. But as an organization, can you take it seriously? Here are all the things we're doing, even though we serve things that are with all of you are doing work regularly at very programs. I mean, we're regularly at support that house. I mean, we're regularly that every third Wednesday our walking group or with the lunch and wants together. It's going to again showcase of we're not being neglectful, we're not being sensitive. We're passionate for it.
Yeah, I mean, I think this would be with any, it's sort of unethical to ignore the problem. Do you know what I mean? And I can see a court maybe saying, how could you not? This person was responding this way to their coworkers, their performance clearly slipped. You know, I would worry that that's what would be pointed at the end and say, no, I'm just saying, yeah. The obligation is definitely around, the employee should ask. But we want co-workers, managers to start having these conversations so that there's some awareness out there. And yeah, it's a hard process to start. But just knowing that you can be supportive without asking about a mental illness. You know, it could be a mental illness, but it could just be a lot of situational factors that are causing this person stress. Can we help support them around those? What kind of things do we have in our community? Hey, I just went and met these guys who talk about psychological health and safety. Let's get them in so we're all aware of this stuff, you know? We do.
Culture in the work environment.
Yeah.
And that's where you have to start to make changes. When you think of police service, it's like a police officer, or you hear about the stresses of an ambulance attendant or paramedic. They have the highest stress rates going. But the reality is what happens is the stigma within ambulance attendants and police services is you're weak if you have mental health issues. So you've got to break down that stigma, that barrier, to say you're not weak. Right? You have an imbalance of physical and mental health, you know, just like it could be physical health. And that's what has to change, just people's attitudes and perceptions, and that's the start. But it does start with, you know, the trust building, the trust, having the discussion, having, you know, people come into your office and have a dialogue and discussion around what is good mental health, what is wellness, you know, as a collective. Clearly, if you're not addressing that employee's issues, they're going to be off sick. They will go on short-term disability. They will go on LTD potentially. And as an employer, that's a cost. So I mean, that's what the employer is thinking about is I want a healthy workplace because this is cutting into my pockets if I'm having to pay out. So from a chamber perspective, business perspective, you're wanting a healthy staff, not just physically, but mentally. That's what you have to be focusing on. And then how do I do that? How do I implement something in my workplace that's going to make it you know, a culture where people have just good values in the business, good support, and people feel comfortable wanting to talk about whatever that may be.
Yep.
Whatever issues, right?
Yeah. And I mean, we saw that number, right? 30% of the claims, okay, but it's 70% of the costs. And that's because those claims are long-term, right? The longer you wait, the sicker you get, the harder it's going to be to get better. So with anything, we want to get it as soon as we catch it. Higher job satisfaction, improves attendance, more effective accommodation, enhances team learning behavior, right? We learn how to work together and to support people when they do need an accommodation, when we need to shift work duties and things like that. And then we have preventative awareness and informed responding, improves knowledge, triggers, strengths, solutions. Basically, we got a team of individuals who knows what they're looking for and how to do something about it. All right. So here's all the stuff we do. Most of these are certificate-based courses. Jack mentioned, I'll just start with this one. It is a new program, but it's assessing for suicide in kids. That's 14 and under. 14 and under. And it was a really popular course. I'm expecting it to be full in September when I run it again. It's unfortunate that we're at a place where we need to look at assessing for suicide in kids, but the reality is that even children's awareness of suicide and awareness of death happens a lot younger than we thought it did. So we need to be prepared because they know more about it than we think they know about it. Assist and Safe Talk are two suicide education programs we provide. Safe Talk is a 3-hour primer. I call it a primer. It's getting you prepared to think about having those conversations with people and just knowing the kind of resources in your community that can help, like the Canadian Mental Health Association. And Assist would be a 2-day course where it prepares you for more of an intensive actual suicide first aid, where I meet this individual and I can do something to help them plan and help them to keep safe.